Right, today we are going to talk in detail about different types of S2 splitting, second heart sound splitting. In previous video we discussed into detail the normal splitting of second heart sound. Today we will be also discussing about wide S2 splitting, fixed S2 splitting and paradoxical S2 splitting. As good doctor, you should be able to auscultate and recognize four type of S2 splitting. Now what are these four pattern of S2 splitting? That I will tell first. Later on I will explain the underlying mechanism of these splits, right? First of all, physiological split. As we discussed previously that physiological, if you listen for heart sounds during expiration in a normal person, then after the S1 at the end of the systole there is S2, and in S2 normally A2 component is earlier and P2 component is little later, right? Here it is P2 component and here it is A2 component. But in a normal person, during expiration, the interval between A2 component and P2 component is so short that you don't hear them as independent sounds. You hear them as one single S2, right? So we can say that this is heard as single S2 in a normal person during, yes, expiration, right? But during inspiration, what really happens that P2 component is delayed when there is inspiration going on, right? Cardiac cycle during inspiration at the end of the ventricular systole, P2 component is significantly delayed, and when P2 component is significantly delayed, then A2 component and P2 component can be auscultated or can be heard at pulmonary area as two sounds, right? Or we can say second heart sound goes under splitting, right? Why? Because there is increased time interval between closure of aortic valve and pulmonary valve during inspiration in a normal person, right? And we say that during expiration second heart sound was heard as single sound. During inspiration in the same person, usually in younger persons, healthy person, it will be heard as split sound. Is that right? So we will say in a normal person during expiration loop, dub, loop, dub, loop, dub. During inspiration loop, drop, loop, drop, loop, drop. This is normal physiological splitting. And normal splitting is appreciated only during inspiration. Clear? Yes. Now we come to another pattern. I told you you should be able to recognize how many pattern? Four pattern. One is normal pattern, other is wide S2 splitting. Now what happens in wide S2 splitting? In wide S2 splitting, problem is that A2 and P2 components are pathologically widened. What happens in wide S2 splitting, that A2 component and P2 component time interval between the closure of A2 and P2 components are pathologically widened, right? And they are so widened that even during expiration you can hear them split, right? So in wide S2 splitting, here is S1, right, and here is A2, but there is significant increase in interval between A2 and P2, and due to this increased interval, even during expiration S2 will be heard as split sound. Is that right?
Yes.
I will explain the mechanism later. And in this case, in wide splitting, A2 P2 interval is so wide that during expiration even it is heard as split sound, and during inspiration, further separation of A to P2 occur. It means during inspiration, there is accentuation of this widening, right? So in this patient, if I draw it here, A2 and P2 interval further widens during inspiration, right? And we can say the split is further accentuated, right? So we can say here where is the widening? Widening is between A to P2 interval, that time interval between the closure of A2 and P2. Aortic valve closure and pulmonary valve closure is pathologically widened, and it is so widened that even it can be heard at expiration, and it is of course further accentuated split during inspiration. If this kind of pattern you hear, right, that you apply the stethoscope at which area? Second intercostal space, left parasternal. What you will hear in wide splitting? During expiration, you will hear loop, drop, loop, drop, loop, drop. And during inspiration, you will hear loop, drop, loop, drop, loop, drop. You understand it? So what really happens? In wide splitting, A to P2 time interval is so much widened that even during expiration, it can be heard as split. But there is splitting varies with the respiratory cycle, that even though it is heard at expiration, during inspiration it further accentuates, right? Then we come to another pattern of S2 splitting, and that is called fixed splitting. That is called fixed S2 splitting. What is fixed splitting S2? Let me explain. In this case, in this patient, of course, first heart sound, then second heart sound in which there is splitting, aortic component, and there is pulmonary component. But why we call it fixed splitting? Because this splitting during inspiration and expiration remains same A to P2 interval. It remains same A to P2 interval, right? They don't accentuate with inspiration. A to P2 interval remain the same, right? Now, during expiration, there is split of the second heart sound. During inspiration, there is also split of second heart sound, and degree of split during expiration and inspiration is fixed. It does not vary. In upper situation, in wide A to P2, right? Even though second heart sound was heard as split during expiration as well as during inspiration, but in wide splitting, this is wide and variable. This is wide and variable because it varies with respiratory cycle. But when we talk about fixed splitting, actually it is wide and fixed. It is wide and fixed. There is wide interval between A2 and P2, but it is fixed. It does not modify with the inspiration or expiration. Now let me tell you, we compare all of them. Again, what is the mechanism as causes of this? We'll discuss later. First, you try to recognize the pattern. You put stethoscope on the pulmonary area, second intercostal space, left parasternal area. In normal person, what you will hear? During expiration, here is expiration, there is inspiration. Now I will repeat all of them. First, I will talk about normal splitting. Then I will talk about wide variable splitting. Then I will talk about wide fixed splitting. Let's start. Clean your ears, okay? Loop, doop, loop, doop, loop, doop, loop, drop, loop, drop, loop, drop. Now we come to the wide. It will be in both conditions. Loop, drop, loop, drop, loop, drop, loop, drop, loop, drop, loop, drop. Now you come here. Here, expiration and inspiration, same splitting. Loop, drop, loop, drop, loop, drop, loop, drop, loop, drop, loop, drop. Is it clear?
Yes, sir.
So what did we say? In normal person, there is inspiratory splitting only. In normal person, there is inspiratory splitting only. In wide S2 splitting, there is expiratory splitting as well as inspiratory splitting, but splitting become more pronounced during inspiration. In fixed splitting, there is expiratory splitting as well as inspiratory splitting, and splitting does not vary during inspiration and expiration. Yes. It means degree of splitting is fixed, right? Then we will talk about another condition. That is called paradoxical splitting. Paradoxical splitting or reverse splitting. Let me explain what is meant by the reverse splitting. First I will draw the normal in this diagram and then I will reverse it. Look, normally what happened? S1, and in S2 first which component come? A2, and that is followed by normally P2. Is that right? This is normal. Now what really happens that in reverse splitting, again normally it is A2 followed by P2, and normally A2 and P2 in normal person during expiration are so close that they are heard as one sound, and in normal person A2 P2 gap interval is widened. Interval is normal person widened, and if this interval is widened, then it will be heard during inspiration as split sound. Is that clear? Yes. Now you imagine, let's suppose this is the P2, right? But due to some reason, aortic valve closure is too much delayed. What happens? Aortic valve closure is too much delayed. If aortic valve closure is too much delayed, right? So rather than at this point, it will move and it will appear here. It will go beyond the P2. Is that right? Yes. That aortic valve closure is too much pathologically delayed, and in this case, even though P2 pulmonary valve is closing at its time, normally aortic valve should close before the pulmonary valve. But in this case, due to pathological delay of aortic valve closure, aortic valve closes after after P2 pulmonary component. And so in this situation, we say that order of closure, the sequence of closure of A2 and P2 is reversed. Normally, first A2 and then P2. But in some situations, in some cardiac situations, A2 is so much delayed that A2 is not before the P2, A2 is after the P2. Is that right? Yes. A2 is after the P2. So it is reversed sequence of closure of aortic and pulmonary valve. And now you imagine, this is during expiration. Imagine during inspiration. Listen, P2 is here, and this is of course first heart sound here, and during expiration this was delayed. This was delayed. But during inspiration, you remember during inspiration normally P2 move gets delayed. Yes. Normally in a healthy person, normal person, during inspiration A2 come earlier and P2 becomes delayed. Now in this person also, during inspiration when P2 will delay, it will fuse with A2. It will fuse with A2, and during inspiration the sound will become single. Again I will repeat. Let's suppose first of all normal. Normally what happen that first is the A2 and then there is P2. Okay, let me take it with the color. This is A2 and here it is P2, right? A2 P2. A for associate, P for professor. Normally second heart sound is like associate professor. Yes. But what is going to happen? This is A2, this is P2. If A2 is too much delayed, then it will come after the P2.
Yes.
Then rather than AP, it will become PA. PA means physician assistant. Is that right? So when position will reverse, associate professor, I mean, normally what is A2 and followed by P2. So we can remember normally it is associate professor, right?
Yes.
But in case of what? In this disease, in this condition, which I will explain in detail later, the problem is A2 is too much delayed and pattern become P2 followed by A2, and now this is PA, not AP, not associate professor, it is PA, physician assistant. Just remember. So position is reversed. Now this type of splitting is called reverse splitting, or this type of splitting is called paradoxical splitting. What is it called? Paradoxical splitting. Now listen carefully. First you compare normal and then paradoxical. Normally during expiration A2 is very near to P2.
Yes.
Normally during expiration A2 is very near to P2. That is why in a normal person during expiration both are heard as one sound.
Yes.
Is that right?
Yes.
But in this disease, when A2 will move ahead, it will cross the P2.
Yes.
And if it crosses so much, it may be heard independent sound during expiration. So we will say there is what kind of splitting? Reverse splitting. But when you go to inspiration, during inspiration normally P2 delays itself. Now in this patient, when P2 will delay itself, it will fuse with the delayed A2, and during inspiration second heart sound will become single. So what we can say that in this type of situation there is paradoxical to the normal, there is reverse to the normal. What is the reverse? Normally A2 P2, here it is P2 A2. This is one thing. Secondly, here during expiration there is single second heart sound, and during inspiration it splits. Is that right? Here A2 crosses P2, during expiration it is heard as split, but during inspiration when P2 moves further, delays itself, it fuses with the delayed A2 and it becomes single sound. Is that right? Yes. So here you will hear, now I will repeat it. During expiration normally there should be no split, but in this patient there will be split during expiration, and here normally during inspiration there is split, yes, but here during inspiration there will be no split. So how the sound will be there in patient with paradoxical or reverse S2 split, that on this pulmonary area you will hear loop, during expiration you will hear loop drop, loop drop, loop drop, but during inspiration loop dup, loop dup, loop dup. Am I clear?
Yes.
Now there are 4 patterns of S2 splitting, right? Mechanisms I will explain later. S2 splitting. S2 splitting mean when A2 and P2 component are audibly separated, right? Audibly separated. There is normal split, which is only inspiratory split, and then there is paradoxical split, which is only expiratory split, and then there is wide splitting, which is during the inspiration and expiration both, but there is inspiratory accentuation of the split, and then there is fixed splitting where S2 is split, but duration of A2 P2 interval does not vary during expiration and inspiration, right? I will repeat these sounds, mechanism later, and then normal sound. Now you will say it with me. Loop, dup, loop, dup, loop, dup, loop, drup, 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 loop, drup. Now you come here, the fixed. Loop, drop, loop, drop, loop, drop, loop, drop, loop, drop, loop, drop. In this case, loop, drop, loop, drop, loop, drop, loop, dop, loop, dop, loop, dop. Clear?
Yes, sir.
Now, I will take another test with you. First, you recognize the normal pattern. Now, you will tell me which pattern. I have put the stethoscope here in a patient, right? In pulmonary area. Sounds due first, sounds are expiration, then inspiration. You will diagnose. Now, first 3 expiratory, 3 sounds during expiration, then 3 sounds during inspiration. Loop, dop, loop, dop, loop, dop. Then loop, drop, loop, drop, loop, drop, loop, drop. What pattern is this?
Normal.
This is normal. Now I will tell you, you put the stethoscope again first, expiratory, during expiration, and then during inspiration. Loop, drop, loop, drop, loop, drop, loop, dop, loop, dop, loop, dop. Paradoxical, very good. Now another. You put stethoscope here. Loop, drop, loop, drop, loop, drop, loop, drop, loop, drop, loop, drop. Wide splitting, very good. And now we come to another pattern. You put stethoscope here. First expiration, then inspiration. Loop, drop, loop, drop, loop, drop, loop, drop, loop, drop, loop, drop. Fixed, very good. So these are the 4 patterns, right? Let's take a break. Then I will explain the underlying mechanism of all these splittings. Already we have discussed the underlying mechanism of normal splitting. But after the break, we'll talk about underlying mechanism of the wide split, which is wide and variable, right? And there is wide and fixed, and then paradoxical split. Very simple. If there is split only during inspiration, think of normal splitting. If only during expiration, paradoxical splitting. If sound is split during inspiration and expiration both, but accentuates during inspiration,
It's a
wide splitting. And if sound is split during inspiration and expiration both, and degree of splitting is same, fixed splitting. Okay, let's have a break.